Hello, my name is Emma, and I will be talking to you about the United States healthcare system versus the Netherlands healthcare system. A look at the Dutch universal healthcare. Introduction. Wouldn't it be wonderful if citizens could receive excellent quality healthcare services immediately minutes away from their home? Dutch citizens can reach their general practitioners within 15 minutes from their homes. Healthcare systems across the globe run similarly according to healthcare titles within the system, along with the organization setups. Healthcare system types. The Netherlands is under the European Union's universal healthcare system, while the United States is under its own private individual system. The Netherlands healthcare system is primarily public, but it also has private insurers entitled within the system. As in the Dutch healthcare system, the minimum cost is between 100 to 120 euros, but it can increase based on the extra services the patient wishes to receive. Healthcare insurance types. Breaking down the Netherlands health insurance plans, it goes into 3 different categories, which consist of compulsory social insurance system, a secondary social insurance plan, and a complementary voluntary insurance plan. The complementary voluntary health insurance plan holds accountable for every other medical service, including the services provided by the 2 social and health insurance plans. General practitioners. In the American and the Dutch healthcare systems, general practitioners are known as gatekeepers that will provide almost all the primary care for the patient in need. According to the Netherlands Health System Review, patients would need to receive a referral from their general practitioner before a medical specialist is consulted. Professional resources. Professional resources include nurses, certified housewives, physiotherapists, local pharmacists, psychologists, social workers, and others. However, the number of resources in each country differs according to accessibility. The physician resources are closer to each other in numbers, with the Netherlands healthcare system being in the lead by 0.5 per capita at 2.9 compared to the United States. Bed rate in both countries. The numbers of hospital beds in the Netherlands from the early 2000s to 2010 were more accessible than the United States. The average number of hospital beds accessible in the Netherlands was around 560 beds, while the total number of beds in general acute hospitals were just around under 45,000 beds. The OECD for the hospital bed rates were one of the lower rates of 4.7 compared to the United States, and it decreased over the years within the Netherlands healthcare system for occupancy rates. The educational system. Compared to the United States healthcare system, the Netherlands takes the lead in the amount of medical graduates it has each year. The Netherlands has been increasing and decreasing over the years with medical graduates, while the United States stayed stagnant at 6.6 per capita. Over the years, the call for medical education was exceedingly high as access to certain services were limited by the educational level. Expenditures. Over the years, statistics have shown that the Netherlands have been gradually spending more on healthcare per capita, with the GDP on healthcare was 12%, which was the second highest GDP on the charts. With the United States healthcare system being in the lead, again with the increase to over $8,000 per capita, the Netherlands was shortly behind with $5,056 per capita. During the expenditures increases, the pharmaceuticals percentage decreased. Inpatient and outpatient clinics. The Netherlands has been expanding their outpatient services to the public over the years since their new reform began. Medical specialists in hospital settings provide for both inpatient and outpatient care needs. Different types of care. There are 3 different types of care within both systems: primary, secondary, and tertiary care. Primary care focuses on continuous and routine care of a patient, which is delivered by general practitioners. Tertiary care is usually done by surgeons to give physical treatment that is based on a referral provided by the PCP. As secondary care focuses on short-term care given by specialists. Privacy laws. Privacy is an important concept to almost everyone, especially within the medical field. HIPAA and GDPR have been created in the laws for both the United States and the Netherlands healthcare system. Netherlands healthcare system implemented the European Union's General Data Protection Regulation to increase the protection of patients' confidential information. The GDPR not only focuses on public health information, but also the patient's personal information. An interesting fact about the GDPR in the Netherlands is that the Dutch citizens have the right to request complete deletion of any healthcare file within their personal information on it. Mental health institutions. Over the years, mental health institutes were starting to give more with the quality of care while continuing to experience obstacles with the wait time to receive the care. There are 3 different levels of mental care that Dutch patients can receive. The first level, which is treated by the general practitioner, usually paired with a specialized mental care practice nurse. Level 2 is known as the basic mental care system, while level 3 deals with complex mental disorders. Information technology. The impact of implementing information technology within the medical fields had created a gateway for the improvement of quality healthcare services globally in each country's healthcare systems. In 1989, the Dutch College of General Practitioners helped the continuation of managing the improvement of quality and safety by creating a program of guideline development and implementation. Conclusion. With the comparisons between the American and the Dutch healthcare systems, the shared similarities are shown through the healthcare providers, physical mental services, and privacy laws. Both countries believe that the improvement of healthcare quality should continue to increase within their system. The difference between the 2 healthcare systems were shown by expenditures, implementation of information technology programs, levels of services provided, and their insurance plans.